Some health conditions might be hard to talk about, even with your doctor, because of the stigma attached that might lead to feelings of embarrassment. For example, troubles with bladder control, bowel control, or sexual dysfunction can be sensitive topics. Now, the good news, there's likely a solution to ease those symptoms by receiving help from a pelvic floor physical therapist. Joining me today is Allison McKay, a board-certified clinical specialist in geriatric physical therapy at the Cincinnati VA Medical Center. Allison, thanks for being here today.
It's great to be here today with you as well.
So what is pelvic floor physical therapy?
Through pelvic floor physical therapy, we treat a variety of conditions, including people who are struggling with incontinence or urinary leakage when they're not expecting it, individuals dealing with constipation or even pelvic pain. Therapy with us through pelvic therapy is to help treat those conditions so that you can get back to doing the things you need to do and having a normal life.
And what can cause people to experience pelvic floor dysfunction?
It can happen from a variety of different conditions. Some are age-related changes. Oftentimes people will experience these changes after the birth of a child or after a pelvic surgery such as a prostatectomy. So we are there to help those people in those situations.
Are there any signs or symptoms that veterans need to be aware of that could be a sign that they're experiencing pelvic floor dysfunction?
Absolutely. So some of the things that you can be aware of is urine sneaking out when it's not supposed to, such as leakage when you're like laughing, coughing, sneezing, any pain during sexual intercourse, or even with a gynecology exam. And then there's other symptoms such as constipation or difficulty producing a bowel movement. Those are all treatable things through addressing the muscles in the pelvic area to function more properly.
So if someone's seeing this and thinks, okay, this might apply to me, what steps should they take?
So a lot of people will go see their gynecologist or their primary care physician or their urologist first, and then those providers refer to us. But there's also direct access in the physical therapy world, meaning that you don't have to go to your provider first. You can come directly to the pelvic health therapist without that initial visit. And during our first session is when we do those assessments to figure out whether pelvic therapy is right for the patient.
Where can veterans go for pelvic floor rehab?
Yeah, so we have private treatment rooms here at the VA on the main campus and out at the Dearborn Seabach with Courtney Kindler. She's another one of our pelvic therapists, as well as we have the option of doing telehealth, which again, the patient would be able to stay at home, stay in their environment, and feel comfortable that way. So we have both the in-person session option and the telehealth option. So I think that really helps us reach, veterans and patients that are farther away and can't make the drive on a consistent basis.
Well, this is a lot of great information. If people want to learn more about pelvic floor physical therapy at the VA, where can they go?
So they, of course, can call our main phone number, which is 513-861-3100. They can ask for physical therapy, or if they're a female veteran, they can ask for the Women's Health Center, or, of course, speaking to their primary care provider.